Hi, my name is Kate. I am an occupational therapy student. This past semester, I've been doing practice questions for the NBCOT exam, and today I'll be going over questions that I got wrong, and I'll just be explaining why they are correct. I'll be explaining the correct answer and my understanding to getting to that point. So the first question is, an OT plans a task-oriented group for adolescents recently diagnosed with anorexia nervosa. Which is the best activity for the therapist to include in the initial session of this group? So the question I chose was making cards to send to veterans in a local hospital. And the correct answer was composing lyrics and melody for a group song. So when I was first answering this question, I was definitely thinking of I was using more of scientific reasoning approach because I was thinking more basically just the condition, just the diagnosis. And I was between these two choices when I was answering this question, but now I can see that D, which is composing lyrics and a melody for a group song, does make more sense when you are using more pragmatic reasoning. And I'm focusing on the realities of this environment. The reality is they are in a group therapy session. So composing lyrics in a song, for a group song, I should say, it's more interactive with your group members. You're using more collaboration, and it is overall more active, which is what questions on the NBCOT are looking. They're looking for a more active activity. So in this sense, both could work, but definitely D is more active when you're in a group setting because you're interacting with everybody else in your group. My next question is, an adult is hospitalized and diagnosed with mild COPD. During the discharge planning session, the person identifies a desire to exercise regularly. Which of the following should the OT recommend the client pursue? The answer I chose was C, low impact aerobics at a local gym, but the correct answer was B, the hospital wellness program's yoga group. So when first looking at this, I put interactive reasoning because I was looking at it, and I know it's what the client wants to exercise regularly and it's discharged, so they're going home. So I was thinking that might be more aligned with the client's desires. But I do understand why B is correct. The hospital wellness plan, this uses more procedural reasoning in what would be great plan of care for an individual with COPD. Originally, another reason why I picked C was because of the word low impact, but understanding that the wellness program yoga can also be low impact for an individual with COPD, but you are also in a safer environment, which is kind of a context that NBCOT is looking for a lot too. When you're in the wellness program's yoga group, they'll work on more breathing exercises, and there'll just be more people there in case of COPD symptoms, overexasperation, and things like that to help. And my third and last question is, an individual with DJD and cured to the right hand, the client is referred to OT due to complaints of severe pain, stiffness, and extreme temperature changes in the hand. The OT referral states that the person has pitting edema, blotchy skin, and shiny skin. Based on the screening, the OT determines that the client's presenting symptoms are consistent with complex regional pain syndrome type 1. The OT plans intervention to address the client's goals to engage in meaningful occupations. Which physical agent modality should the OT use in preparation for functional activity? So when first looking at this question, I answered A, which is TENS, and the correct answer is B, which is a contrast bath. When looking at this originally, I used procedural reasoning because I was thinking of how you would go with treatment of this and thinking of, so the person has an edema, and a contraindication would be to not use heat with edema. And I know contrast bath, it uses like alternating warm and cool temperatures. So I thought that would not work because of the warm temperatures, but when reading more about it and looking at my textbooks after, I do understand more why a contrast bath would work. They can be used for people with edema. The warm and cool temperatures can actually manage the edema and improve the circulation in the area. It also helps normalize the temperatures, which was an issue that was presented in the question. And TENS could work, but its main thing is it reduces pain. It doesn't really help with any of the other concerns like the temperature and the edema. So I do understand why the contrast bath is better, and you still could use procedural reasoning when answering with a contrast bath answer because you're thinking of the best treatment style and what you would do with the client's diagnosis. So, yep, thank you.